There's been a lot of discussion and research lately about oral health linked to systemic health and things like that. Let's take diabetes, for example.
Diabetes has what we call a bidirectional relationship with periodontal disease. And what that means is that if someone has uncontrolled diabetes or like a uncontrolled A1C, uncontrolled blood sugar, it makes them more prone to have active gum disease, and it makes it harder to control their gum disease. And also if they have active gum disease, untreated gum disease, rampant gum disease, there are a lot of systemic issues that periodontal disease basically predisposes you to, or that there is a correlation with. So some of those things are like, if you have untreated perio disease, you have a higher risk for Alzheimer's, for instance, because the same bacteria in our mouths don't just stay in our mouths, they go throughout our entire bloodstream. The same plaque that builds in our mouth also builds on our hearts and our brains. So that's also why perio is linked to cardiovascular disease, and a heightened risk for cardiovascular disease, chronic kidney disease, and even certain cancers, believe it or not. Certain bacteria are involved in that process.
Well, I know that there's been a lot of studies that have shown that the bacteria that's only found in the mouth has been found around the blood vessels of the heart. So it just kind of goes to show you that truly what we ingest is going through our body.
Exactly.
So,
and that's also why some patients who have had joint replacements or have had a history of endocarditis have to actually pre-medicate or take antibiotics before we clean their teeth, because when we clean their teeth, it creates something called bacteremia. So it's just basically heightening the load of that bacteria found in the mouth into the entire bloodstream, which can cause infection around the heart or around a new joint, for instance. So, but that same process is occurring constantly, just on a lower level. So, they constantly have that bacterial kind of exposure to their body.
I'm a firm believer that prevention is the best medicine, but sometimes that extra cleaning really makes a difference. And being preventative and being on top of things and coming an extra time or two throughout the year helps keep the bacterial load down and could help us, I would say, prevent those disease earlier on.
Absolutely.
As opposed to letting it get to the later stages of it.
Anything we can do to keep you out of more extensive dentistry is like what you and I specialize in,
for sure.